हेलो एवरीवन, आज की इस वीडियो में हम देखने वाले हैं उत्तराखंड नर्सिंग ट्यूटर एग्ज़ाम जो कि 2023 में हुआ था। इसमें टोटल 195 क्वेश्चंस रहने वाले हैं, जिसमें से 100 क्वेश्चन रहेंगे नर्सिंग के और जो नेक्स्ट जो 95 क्वेश्चंस रहेंगे वो अदर सब्जेक्ट के रहने वाले हैं। तो इस वीडियो में हम लोग नर्सिंग वाला पोर्शन देखेंगे। ये एग्ज़ाम कंडक्ट करवाया था UKMSSB ने। तो सबसे पहला जो क्वेश्चन है वो है, अकॉर्डिंग टू द मास्लोज हायरार्की ऑफ नीड द हाईएस्ट लेवल इज सेल्फ एक्चुअलाइजेशन। द करेक्ट ऑप्शन इज डी। इंटरपर्सनल कम्युनिकेशन इज ऑल्सो नोन एज dyadic communication. The correct option is B. Teaching method in which student learn to do critical thinking through discussion and interaction and develop higher analytic cognitive skills. The correct option is option A. Methods of teaching in which an excursion to the patient's area is arranged to provide learning experience to the student is nursing round. The correct option is option B. Then question number 5. If a group of 10 people are speaking on a topic of common interest in an educational program is called group discussion. The correct option is option C. All of the following are the methods of clinical teaching except. तो इसके जो है वो सारे आंसर रहने वाले हैं, तो ये आंसर विड्रॉ हो गया था क्वेश्चन। नेक्स्ट है क्वेश्चन नंबर 7. हु स्टार्टेड एजुकेशन इज़ नॉट अ प्रिपरेशन ऑफ लाइफ, एजुकेशन इज़ लाइफ इटसेल्फ. द करेक्ट ऑप्शन इज ऑप्शन सी, जॉन डेवी. देन क्वेश्चन नंबर 8. टू डिक्रीज द रिस्क ऑफ एस्पिरेशन while feeding a patient with dysphagia, nursing intervention of choice is option A is correct. Then question number 9. Collapsing pulse is known as Watson water hammer pulse. The option B is correct. Question number 10. Agnosia is a neurological disorder marked by inability to recognize an object correctly. The correct option is option B. Question number 11. As per the Kubler-Ross theory of grief, which behavior is observed in stage 2, that is anger? Then the correct option is option B. Next question is question 12. Which among of following blood test is recommended to a client on heparin therapy? The correct option is option D, APTT. Question number 13. Complication of blood transfusion include all of above. The option D is correct. Question number 14. A breathing pattern characterized by a cycle of alternating periods of shallow and deep breathing followed by pause. The correct option is option A, Cheyne-Stokes respiration. Question number 15. A medical emergency characterized by rapid, deep and labored breathing is called Kussmaul's respiration. The correct option is C. The preliminary assessment of a patient's or casualties in order to determine the urgency of their need to treatment and the nature of treatment is required as that correct option is option D, tries. Question number 17. A condition where a number of heartbeats is greater than the number of pulse felt. The correct option is option C, pulse deficit. Question number 18. A condition where a person's blood pressure drop when they stand up or sit down. The correct option is B, orthostatic hypotension. Question number 19. Which of the following method is used to administer BCG vaccine? Correct option is B. Question number 20. The HbA1c is a primarily measure to identify mean plasma glucose concentration of over 90 days. The correct answer is D. Question number 18. A screening test that assesses hearing loss in 1 year by comparing how well a patient can hear sound transmitted through ear conduction versus bone conduction. The correct option is B, Rene's test. Question number 22. Trosis sign is a clinical sign of hypocalcemia. The correct option is A. Color of the bag used in biomedical waste for discarding human anatomical waste, animal waste, and the soil waste is in yellow bag. Correct option is A. The type of uterine prolapse in which of the uterus completely protrudes out the vaginal canal is called fourth degree. The correct option is A. The most common abnormality found in man which azoospermia is, the correct option is option C. Question number 26. A condition that causes inflammation of the fallopian tubes is salpingitis. The correct option is C. All of the following are the example of enriched media except the correct option is option C. Question number 28. The tendinization is a method of, the correct option is fractional sterilization. Correct option is option D. 29. Question number. Administration of OPV would stimulate which type of immunity? Correct option is D. Question number 30. Most common cause of infantile diarrhea is rotavirus. The correct option is option B. Question number 31. Question number 31. The hydatid caused by Echinococcus granulosus. Question number 32. Most widely used egg-based media for the cultivation of Mycobacterium tuberculosis is, option number A is correct. Most common HPV genotypes associated with carcinoma of cervix are, question number A is correct. Pulse-Banel test is used to diagnose infectious mononucleosis. The correct option is option D. A specific gravity of urine increase in diabetes mellitus. Correct option is option A. The homopolysaccharides used for intravenous infusion as plasma substitute is, option A is correct. Question number 37. Aspirin inhibit the activity of enzyme. The correct option is B, cyclooxygenase. Question number 38. Deficiency of glucose 6-phosphate dehydrogenase caused, correct option is B. Then the tumor marker is elevated in some case of hepatocellular carcinoma. The correct option is A. Which class of drug is commonly prescribed to lower the cholesterol level by inhibiting the enzyme HMG coenzyme A reductase? The correct option is C. Which of the following drug is beta-lactam inhibitor? The correct option is C. Biotransformation of a drug is to render theme. The correct option is option D. Question number 43. Conjugation of a drug include all the following except hydrolysis. The correct option is C. Tachyphylaxis is a very rapid developing tolerance. The correct option is B. Which drug has been known to cause discoloration of a tongue? The correct option is C. Essential list. The essential drug list is a list of drugs required for a priority needs of the population. The correct option is B. The water hammer pulse is seen in Aortic regurgitation, the correct option is option B. The edema is defined as a clinically apparent increase in interstitial fluid volume. Correct. Then question number 49 is pulse paradoxus is defined as a decrease in systolic atrial pressure. The correct option is option A. Holiday heart syndrome is the term used to cardiotoxicity produced by alcohol. The correct option is A. Osborne's wave in ECG is found in hypothermia. The correct option is B. The Hammond signs is characteristics of the option B. Pneumomedia STM. Cage questionnaire is used to. Question number C is correct. The Gale's test is done in osteosclerosis. The correct option is C. The Uzina is also known as atrophic rhinitis. Question number 56. Traits of Young's syndrome. The correct option is B. Bronchiectasis, chronic rhinosinusitis, and infertility. Then question number 57. Ortolani's test is done for congenital dislocation of hip. The correct option is option A. Question number 58. Lashl's classification system is used for cleft lip. The correct option is C. Question number 59. Ranson's criteria used for acute pancreatitis. The correct option is option A. Most common organism of surgical site infection is Streptococcus aureus. Correct option is option A. Question number 61. The Fourniers gangrene affect which part of the body? The genital region. The correct option is option C. Question number 62. Which of the following are not components of revised trauma score? The correct option is B. Then question number 63. How many people are needed to perform log rule manual in trauma patient according to the ATLS guidelines? इसमें आई थिंक 2 ऑप्शन हैं जो करेक्ट हो सकते हैं, 5 और 4. तो ऑप्शन ए और सी में से कुछ हो सकता है, दोनों ही करेक्ट हैं. देन PIRADS scoring system is used for prostate. The correct option is C. Question number 65. Which of the following suture material is a non-absorbable suture? The correct option is B. Question number 66. Which of the following is not a complication related to total parental nutrition? The correct option is hypoglycemia. Question number 67. Which of the following is not a criteria for brain death? Question number C is correct. Question number 68. Which neurotransmitter is associated with occurrence of obsessive compulsive disorder? The correct option is A. Question number 69. Which of the following is a fluid of choice for resuscitation for a burn patient in first 12 hours? The correct option is A. Hartmann solution, that is RL. Question number 70. Which of the following is a risk factor for thrombosis? The correct option is A. All of above. Which of the following is not a part of anesthetic triad used during surgery? The correct option is B. Question number 72. A second degree burn is characterized by which of the following? The correct option is D. Question number 73. A 46-year-old man is on a waiting list to secure a renal transplant. The genetic locus of a transplant antigen in human is known as. Correct option is option C. Question number 74. What is the most common post-operative complication that may rise in patient who undergone an appendectomy? The correct option is option A. Question number 75. High level of alpha fetoprotein in mother's blood indicate that developing baby has a neural tube defect. The correct option is option B. Question number 76. The 3Ds, diarrhea, dementia, and dermatitis, are the characteristics of deficiency of. The correct option is A. Niacin. Question number 77. All are components of Kuppavaswamy classification of socio-economic status except number of children. Question number 78. Following imaging modalities, which is safest during pregnancy? The correct option is A. What happened to expiratory residual volume in pregnancy at term? The correct option is option D. What is the reason that vitamin K is administered in newborn within first hour of birth? The correct option is option B. Question number 81. Which of the use of which of the following method of labor induction is contraindicated in a patient with a prior cesarean delivery? The correct option is option C. Misoprostol. Question number 81. Which of the following is a known risk factor for breech presentation? The correct option is option A. Oligohydramnios. Question number 83. Which of the following define heteropic pregnancy? The correct option is option A. The most common cause of hysterism in a teenage girl is PCOD. Question number 85. Complete failure of Mullerian duct fusion will result in. Option number A. The first sign of puberty in girls is. Correct option is option A. Question number 87. Non-gonococcal urethritis is caused by chlamydia. The correct option is option A. Question number 88. A 28-year-old multipara has a uterine prolapse. The management of choices. The Fothergill's repairment with tubal ligation. The correct option is option B. Question number 89. Investigation of choice for tubal patency is HSG. The correct option is option A. Question number 19. Billing method of contraception refers to cervical mucus method. Correct option is option B. Question number 91. What is the true for Minera? The correct option is option C. Question number 92. Menorrhagia is defined as blood loss per vaginal more than 80 ml. The correct option is option A. Question number 93. A 10-month-old infant developed fever which was followed by maculopapular rashes. On the next day, it was accompanied with cough, nasal discharge. The most likely diagnosis of measles. The correct option is option B. Question number 92. Mother of an exclusively breastfed infant aged 4 weeks with adequate weight gain complains of frequent stool after feed. Baby is otherwise active and playful. The most common appropriate treatment is, correct option is option C. Question number 95. Microcephaly is defined as the head circumference less than 2 st. The correct option is option B. Question number 96. The period between possible time of detection and the actual time of detection and the actual time of diagnosis. The correct option is option A. Question number 97. Confidentiality of a patient can be the confidentiality of a patient can be breached under which of the following condition? The correct option is option D, all of above. Then question number 98. PERT is a technique for network analysis. The correct option is option A. Question number 99. The pandemic alert phase level 5 means the widespread human transmission. The correct option is option B. Question number 100. In what stage of demographic cycle is India today? The correct option है option D, late expanding. तो ये वीडियो में सिर्फ नर्सिंग से रिलेटेड क्वेश्चंस थे जो कि OBG, साइकेट्रिक एंड कम्युनिटी और मेडिकल सर्जिकल ये सारे सब्जेक्ट से रिलेटेड थे. नेक्स्ट जो क्वेश्चन पेपर होगा उसमें नॉन नर्सिंग के जितने भी क्वेश्चंस होंगे वो कवर करेंगे. वीडियो ऑलरेडी बहुत लॉन्ग हो चुका है तो इसका मैं सेकंड पार्ट बना लूँगी. तो आप लोग चैनल को ज़्यादा से ज़्यादा सब्सक्राइब करें और अपने दोस्तों में शेयर करें. और अगर इसमें कोई भी ऑप्शन में कुछ करेक्शन हो या फिर कोई चीज़ ऐसी हो जो मैंने मिस कर दी हो या रॉन्ग हो तो प्लीज़ मुझे फीडबैक ज़रूर दें और चैनल को ज़्यादा से ज़्यादा शेयर करें, सब्सक्राइब करें. थैंक यू फॉर वॉचिंग.